Hi everyone, welcome back. We're going to talk today about Child Health, Chapter 10. And my name is Jody Sutherland, and I'll take you through some of the important aspects of this chapter. As always, be sure to review the learning objectives, as this will help you prepare for the exam. We want to talk first about the importance of child health, and the text gives us some important things to consider as we think about the health of children and its impact on, again, society as a whole. We see that approximately 8.8 million children under the age of 5 die in the world each year, and we can see that this is equivalent to 24,000 children every day. Back in 2011, there was a report by UNICEF, and at that point they had that 21,000 children died around the world each day. So we see that statistic actually is a little bit larger now. And we can see that this is the equivalent to one child dying every 4 seconds, or 14 children dying every minute. Alternatively, if we were to think about world events, it would be like the 2010 Haiti earthquake occurring every 10 days. This is the magnitude of this death toll. Or the 2004 Asian tsunami occurring every 11 days. And between 2000 and 2010, 92 million children died. And oftentimes we'll find that there's some common factors that increase risk for this, and we'll talk about those in a little bit. It's important for us to understand that children in the developing countries are disproportionately affected by a lot of these health risk factors that contribute to child mortality. And remember that child mortality, we studied that a few chapters ago, is the number of children who die by the age of 5 out of every 1,000 live births. So we'll be looking at that statistic, or at statistics related to that as we study this chapter. The reason that we want to look at child health and its importance is because we will soon understand that the majority of these deaths are actually preventable. And again, that's where public health efforts can make a huge impact on teaching basic hygiene, how and where to defecate, ridding your community of stale water, stagnant water that may attract mosquitoes, malaria-bearing mosquitoes, things such as that. And the text goes on to say that more of half of these deaths could be avoided through some low-cost interventions. And again, it's important for us to understand that a lot of these interventions don't cost millions and millions of dollars. They are low cost, but we still need mechanisms to be able to implement them. We also know that this is a vulnerable population. Again, that we need to try to, again, develop policies and programs that can help them. It's important to note that child health is closely linked with poverty. We talked a little bit about the environment, and we'll talk about diarrheal diseases and things such as that, oftentimes related to sanitation and lacking access to safe drinking water, and again, a poor environment as it relates to sanitation and cleanliness. Approximately 2.2 billion children currently live in poverty, and so that's basically every other child lives in poverty. And again, some nations are disproportionately affected when we think about that. We've talked about the link between economic development and education, and health and education. There are over 72 million primary aged youth who are not enrolled in school, oftentimes not having access to education. But among those 72 million, 57% of those children are females. So again, we just finished up a chapter on the health of women, and we know how these social determinants and gender and having a prescribed role can have an impact on the health and well-being. So again, we need to try to close these gaps. As you read through the chapter this time, again, always pay attention to the key terms, as these are probably going to pop up on your exam, but they'll also help you to understand the concepts, specifically as it relates to neonatal. We will, as you read through the text, you will notice that term reoccurring throughout. And again, here are the rest of those terms that it will be important for you to understand. Also, as you read, you will want to understand the burden of these childhood illnesses. It's important to note that of these deaths, again, this is a staggering statistic, but 99% of them are in low and middle income countries. So again, there is such a huge deficit here that we need, and a huge disparity that we should and are trying to address. And we can see that almost half of those deaths actually occur in only 5 countries. Again, a staggering reality of what is going on in a situation that, again, we need to try to make an impact. And then as we read on through here, we figure out that of those deaths, approximately 41% occur within the first month of life, so when the child is less than 28 days old. And we can see where the rates are actually the highest for this neonatal mortality: Africa, Southeast Asia, and the Mediterranean region. And we'll talk a little bit more about that, but again, it goes back to the social determinants of health. Those individuals with low or who are among the poorest in their community, oftentimes again lacking adequate education, are likely illiterate, live in rural, isolated communities with little or no access to society as a whole or to the community, and this marginalizes them and again greatly increases their risk for death prior to or within that 28-day period. In addition to that, then living in these communities, oftentimes having little to no access to health care. And we can see a similar statistic when we think about under 5 mortality, again with sub-Saharan Africa being disproportionately affected. And so we can see here these neonatal mortality rates. They're a little dated, but we see that Africa having the highest rate of children who die within that first month. And then once again, in this table, again, sub-Saharan Africa being disproportionately affected for both infant and under 5 mortality rates. When we think about some of the factors that contribute to that, we can see here that pneumonia and diarrhea are at the top of the list here. So they are the number 1 and 2 causes of death in children under 5. And again, pneumonia may surprise you, but the text goes on to describe the fact that there are a lot of respiratory infections and the common cold and things such as that then contribute to these types of problems. We can see here that pneumonia is the leading cause of death in Southeast Asia, and the second in Africa, and the third in the Americas. And we see that diarrhea remains important in all the regions and is a leading cause of death in Africa, and then second in Southeast Asia, and so on and so forth. And then behind that we see here malaria also weighing in, contributing to child mortality rates. When we think about diarrhea, and again we've already talked about our diarrheal diseases, and we've already discussed how poverty is linked to so many of these problems, it's important to know that worldwide, and we've already went through some of these statistics, but 1 billion people lack adequate access to water. Children are even more vulnerable, again, than even the adults. And so that contributes, again, to these high rates of child death. In addition to 1.1 billion lacking adequate access to water, 2.6 lack adequate access to sanitation, again contributing to these high rates of infectious diseases. And diarrheal diseases account for about 1.8 million deaths annually in the population. Make sure you pay attention or just take note of the different figures here as it goes through the leading causes of death and the neonatals, the post-neonatal. And then here again, we've already discussed this, but it breaks it down by region. What are the top causes? And we can do some comparison to see if there's something unique in a specific country versus what's going on in Southeast Asia region versus what's going on in Africa. And then we can break that down once again by country to country specific and see if there are any things that are unique to those countries that we might be able to impact on. The text also talks about additional causes of morbidity and mortality, and that again looking at acute respiratory infections, and children are very prone to those both in the United States and internationally. The difference is we have better access to treatment, whereas in some nations they don't. We see that the common cold and ear infections contribute greatly to this. And if we were able to give our children pneumococcus and a HIV immunization, we would be able to buy the largest amount of healthy life years, specifically in Africa. So we can make a huge impact just by offering these 2 vaccinations in Africa. You'll read more about, again, diarrhea, diarrheal diseases, and also malaria. Now, when we think about neonatal mortality, we're being very specific at that moment, but it's still important for us to understand that there are, within that time frame, there are children that are more at risk, and every day that a child lives, they're more likely to survive over time. So the text states that it's important for us to note, and when we think about from an epidemiological standpoint, when the child death takes place, where it takes place, and why they occur, in order to, again, get to the root problem. And we see that 75% of these deaths occur in the first month of life, so we've pinpointed it, right? However, that 75% of deaths that occur during that first month of life actually occur during the first week. And within that first week, we can see that of those 75% of those deaths, 25% of those actually then occur within the first 24 hours of the child's life. So we can see that's a very critical and vulnerable point where we could try to intervene and buttress and provide buttresses and supports that would increase the likelihood that that child would be able to thrive and survive. We see here some of the risk factors related to child death. We've already talked about some of them, namely poverty, so I won't go back over that. Also related to that, family income. Obviously, the more income, generally the better educated, the more likely to have access. And we can see all the way down with this. It's a 2006 report, but the disparity in death rates for those children that are born with a family that has education versus those that are not. And then lastly, access to appropriate health care. In the next section down, you'll want to read through the costs and consequences of child morbidity and mortality. And again, this has both immediate, short-term, and long-term impacts on both the individual, the family, as well as the community and society overall. So it has a layered impact, and again, some of that can be felt immediately, but some of those impacts may take years to actually manifest themselves. Next, you'll read through the policy and program briefs, and then the chapter will conclude with how to address key challenges to health in the future. And we see that there has been some progress in the past few years, and it's important to note that, but again, it's not equal in nature, and so we see that some countries are lagging behind, specifically again when we think about sub-Saharan Africa and Southeast Asia. 30% of all children in the developing countries are underweight or stunted, and again, the rates are even higher in this region. And the Millennium Development Goals are not on track for eliminating this disparity or these disparities in causes of death and reducing that actual death rate. They're going to miss it by 30 million children, again due primarily to the slow progress in the sub-Saharan Africa and Southeast Asia region. And this again are because of some of the factors that we mentioned, that millions of children in this region lack access to proper nutrition, to health care services, to education, to clean water, sanitation, and to adequate shelter. It's estimated that 1 in 7 have no access. 1 in 7 children have no access to health services. So again, this will have a huge impact on the health and well-being of those individuals. Children in these regions are also more vulnerable to some of the worst forms of child labor, whether it be trafficking, armed conflict, slavery, sexual exploitation. A lot of this is, reached the media, and we see again the impact that this can have on these children's lives. And again, when we think about the fact that poverty is often intergenerational, focusing on children's rights and reducing child poverty is important in breaking the cycle of poverty, again, for future generations. And as we think about malnutrition, again, this contributes to over 1/3 of all of these deaths, so it has a huge impact. And so just being able to provide nutrient supplements and encouraging breastfeeding, these are some of the most important ways of reducing their children's vulnerability to disease. We see that there are, again, many cost-effective interventions that are aimed at addressing some of these main contributing factors. For example, providing mosquito nets to try to reduce the transmission of malaria, but unfortunately they're not widely used. And so how can we try to encourage uptake of some of these available interventions that could, again, enhance the well-being of those populations? So trying to address the uptake of these approaches, especially again in Southeast Asia, or South Asia, and Sub-Saharan Africa. So what can we do? And again, from a public health standpoint, from a cultural standpoint, from a socio-cultural standpoint, how can we encourage that? So really starting with the children and helping them to adopt these behaviors would be important, again, to start to see the tide turn a little bit. We think about the time frame and the timing of these interventions. We have to think about the mother or the mother-to-be. How can we help them establish good nutritional habits or have good nutritional status prior to even being with child? That's important. And we'll skip on over here and look at managing diarrheal diseases in children. Again, thinking about poverty, thinking about rurality, access. 1 in 5 children lack no access to safe water. And this will be important to address. Again, if we're going to see some of these factors be reduced or eliminated as contributing to high rates of child mortality. When we think about some of the programs, we see that there has been progress in immunizations, but still a lot to be done. Again, if we could have better uptake in countries such as Sub-Saharan Africa, we could see, or regions such as Sub-Saharan Africa, we could see a big impact there. But when we think about the types of approaches, community-based approaches are often better at encouraging uptake, because by doing a community-based approach, you're empowering individuals as well as encouraging uptake among the wider population. So those are some of the ways that we can try to address some of these health issues that are impacting on the health and well-being of children, but also of families and communities at large. So as you conclude the chapter, make sure you read through the study questions, and that should help prepare you for the exam. Thank you.